Imagine waiting for years for a brain-computer interface that could restore movement, only to have it fail because it trains too fast or activates the wrong nerves, causing pain instead of relief. Hello everyone, I'm Anubhav Mohapatra, a junior at Prosper High School, and I truly believe we can fix this problem by answering just one overlooked question. 15.4 million people have paralysis. The BCI market is growing to $6.2 billion by 2030. Yet, today, devices underperform because of one unanswered question. How should electrode contacts be spaced? Right now, there are simply no guidelines. Engineers guess, and when wrong, devices drain batteries faster and can't target the right nerve fibers precisely. Imagine this. Imagine trying to move your hand but accidentally triggering your diaphragm. That's a real design failure from poor spacing optimization. This is a critical geometry problem nobody has systematically solved. My research fills that gap. Researchers have optimized materials and algorithms, but inter-electrode spacing, easily modifiable and cost-neutral, remains unmapped. My hypothesis? Optimal spacing exists somewhere around 0.5 to 1 millimeters, balancing low current needs with precise selectivity. This study will prove it with data. My research has three key aims: quantify how spacing affects stimulation thresholds, evaluate its impact on selectivity, and produce design heuristics engineers today can use immediately. On a similar line, my research has three major questions. Number one, how does spacing influence threshold current? Number two, how does it affect selectivity? And finally, which configurations optimize the trade-off for practical current BCI devices? The methodology that I'll be using for my research will be finite element modeling in COMSOL to build a virtual vagus nerve model with realistic tissue properties. I vary spacing from 0.5 to 4 millimeters and measure threshold current, activation volume, and selectivity index, three of the key variables for my research. What makes this more rigorous is the Monte Carlo simulations, 10 iterations per condition, randomly varying biological parameters to generate confidence intervals. This tests whether findings hold when biology gets really messy, like stress testing a bridge under real-world conditions. So here's the nerve at different spacings, 1.2, 2.4, and 3.6 millimeters. Notice here how field distribution changes dramatically. My simulations quantify these trade-offs with statistical precision, moving from guesswork to actual design rules. So what is the deliverable, you ask? The deliverable here are the reproducible datasets and spacing recommendations with confidence intervals that engineers today can implement tomorrow. All code will be open source, so labs all across the world can validate and build on this foundation, accelerating development for the millions of people who need these devices. My solution will be optimal spacing that predicts around 0.5 to 1 millimeters and overall reduces simulation thresholds while maintaining average selectivity. The solution and sampling plan will be distributed in 4 key stages, ranging from designing, testing, sampling, and eventually final distributions. So, what is my future vision for this research? I believe that currently we are at a key inflection point. 15.4 million people need brain-computer interfaces that work reliably. This research provides design guidance to reduce failures and improve outcomes for people all across the globe. So, let's stop guessing and begin optimizing. Thank you very much.